NCSB NCLEX Questions and Answers Full Practice Test Updated 2026. Question 1. ALPN complains to the charge nurse that an unlicensed assistive person, UAP, consistently leaves the work area untidy and does not restock supplies. What is the best initial response by the charge nurse? Option A. Write down potential solutions to the problems today by shift's end. Option B. Add this concern to the agenda of the next unit meeting. Option C. Assure the staff nurse that the complaint will be investigated. Option D. Explore for further identification about the nature of the problem. The correct answer is option D. Explore for further identification about the nature of the problem. Explore for further identification about the nature of the problem. Question 2. The nurse assists with the reinforcement of information about breast self-examination to a group of college students. A female student asks when to perform the monthly exam. The appropriate reply by the nurse should include which statement? Option A. Ovulation, or mid-cycle is the best time to detect changes. Option B. Do the exam at the same time every month. Option C. Right after the period, when your breasts are less tender. Option D. The first of every month, because it will be easiest to remember. The correct answer is option C. Right after the period, when your breasts are less tender. 3. Question 3. The nurse is caring for a 75-year-old client with type 2 diabetes mellitus. The client should be instructed to contact the outpatient clinic immediately if which findings are present. Option A. An open wound on the heel with minimal discomfort. Option B. Occasional hiccups and sneezing. Option C. Sustained insomnia and daytime fatigue. Option D. Persistent dryness and itching of the perineal area. The correct answer is option A. An open wound on the heel with minimal discomfort. 1. An open wound on the heel with minimal discomfort. Question 4. A pregnant woman has been advised to alter her diet during pregnancy by increasing the intake of protein and vitamin C to meet the needs of the growing fetus. Which diet choice would best meet the woman's needs? 1. Option A. Cup of macaroni, 3/4 cup of peas, glass whole milk, medium pear. Option B. Scrambled egg, hash brown potatoes, 1/2 glass of buttermilk, large nectarine. Option C. 3 ounces chicken, 1/2 cup of corn, lettuce salad, small banana. Option D. Beef, 1/2 cup of lima beans, glass of skim milk, 3/4 cup of strawberries. The correct answer is option D. Beef, 1/2 cup of lima beans, glass of skim milk, 3/4 cup of strawberries. 4. Beef, 1/2 cup of lima beans, glass of skim milk, 3/4 cup of strawberries. Question 5. A nurse is taking a health history from parents of a child admitted with possible Reye's syndrome. Which recent illness should the nurse recognize as being associated with and increase the risk for the development of Reye's syndrome? Option A. Varicella. Option B. Meningitis. Option C. Hepatitis. Option D. Rubella. The correct answer is option A. Varicella. 1. Varicella. Question 6. A Native American chief visits his newborn son and performs a traditional ceremony that involves feathers and chanting. The nurse comments to a colleague, "I wonder if he has any idea how ridiculous he looks, he's a grown man." The nurse's comment is an example of what type of attitude? Option A. Prejudice. Option B. Ethnocentrism. Option C. Discrimination. Option D. Stereotyping. The correct answer is option A. Prejudice. 1. Prejudice. Question 7. A nursing student asks the licensed practical nurse, LPN, to explain the forces that drive healthcare reform. When responding to the student's question, what information should the nurse emphasize? Option A. Increased competition between healthcare insurers. Option B. Increase in healthcare spending that's growing faster than the economy. Option C. Increase in the population who have health insurance. Option D. Increase in spending for end-of-life treatment. The correct answer is option B. Increase in healthcare spending that's growing faster than the economy. 2. Question 8. A child is admitted to the unit with the suspected diagnosis of pertussis, whooping cough. What is the priority nursing intervention for this child? Option A. Maintain hydration and encourage fluids. Option B. Implement droplet precautions. Option C. Monitor respiratory rate and oxygen saturation. Option D. Anti-infective therapy. The correct answer is option B. Implement droplet precautions. 2. Question 9. A client has an indwelling catheter with continuous bladder irrigation after undergoing a transurethral resection of the prostate, TURP, 12 hours ago. Which finding at this time should be reported to the registered nurse, RN, charge nurse? Option A, complaints for the feeling of pulling on the urinary catheter. Option B, light, pink to clear urine. Option C, occasional suprapubic cramping. Option D, minimal drainage into the urinary collection bag. The correct answer is option D, minimal drainage into the urinary collection bag. For minimal drainage into the urinary collection bag. Question 10. A nurse is caring for a woman 2 hours after a vaginal delivery. Documentation indicates that the membranes ruptured 36 hours prior to delivery. Which of these nursing diagnoses should the nurse expect the charge nurse to list as a priority at this time? Option A, risk for fluid volume deficit. Option B, risk for excessive bleeding. Option C, risk for infection. Option D, altered tissue perfusion. The correct answer is option C, risk for infection. 3. Question 11. A 14-month-old child ingests a half a bottle of baby aspirin, 81 mg, tablets. Which finding should a nurse expect to see in the child? Option A, hypothermia. Option B, nausea and vomiting. Option C, hypoventilation. Option D, bradycardia. The correct answer is option B, nausea and vomiting. 2. Question 12. A school nurse monitors a child with a history of tonic-clonic seizures. The school nurse should inform teachers that if the child falls to the floor and experiences a seizure while in the classroom, which of the following would be the most important action to take during the seizure? Option A, place the hands or a folded blanket under the head of the child. Option B, provide privacy as much as possible to minimize frightening the other children. Option C, move any chairs or desks at least 3 feet away from the child. Option D, note the sequence of movements with the time lapse of the event. The correct answer is option A, place the hands or a folded blanket under the head of the child. 1. Place the hands or a folded blanket under the head of the child. Question 13. A client is admitted with diagnosis of a right upper lobe infiltrate and to rule out active tuberculosis, TB. Which type of precautions will be needed for this client? Option A, droplet. Option B, contact. Option C, standard. Option D, airborne. The correct answer is option D, airborne. 4. Question 14. A client has had a positive reaction to purified protein derivative, PPD. Which statement made by the client suggests the client understands the teaching by the registered nurse, RN? Option A, I have active tuberculosis. Option B, I have been exposed to Mycobacterium tuberculosis. Option C, I have never been infected with Mycobacterium tuberculosis. Option D, I have never had tuberculosis. The correct answer is option B, I have been exposed to Mycobacterium tuberculosis. 2. Question 15. A nurse is caring for a client with pneumococcal pneumonia. Which breath sounds would the nurse expect to disappear as the client responds to the antibiotic treatment? Option A, wheezes. Option B, friction rubs. Option C, ronchi. Option D, diminished sounds. The correct answer is option C, ronchi. 3. Question 16. A young adult seeks treatment in an outpatient mental health center. The client tells a nurse, I am a government official and spies are following me. Upon further questioning, the client reveals that warnings must be heeded to prevent nuclear war. What is the initial therapeutic approach that the nurse should use? Option A, listen quietly without comment. Option B, ask for further information on the spies. Option C, confront the client about the delusions. Option D, contact security for potential safety concerns. The correct answer is option A, listen quietly without comment. 1. Listen quietly without comment. Question 17. Lactulose has been prescribed for a client with advanced liver disease. Which finding should the nurse use to evaluate the effectiveness of this treatment? Option A, less jaundice. Option B, increased appetite. Option C, decreased lethargy. Option D, less edema. The correct answer is option C, decreased lethargy. 3. Question 18. The LPN is unsure about an assignment by the charge nurse to hang an intravenous, 4, infusion that contains potassium. What resource should the LPN check first to determine if LPNs can administer 4 medications? Option A, employer policy and procedures manuals. Option B, nursing faculty from a local nursing program. Option C, The Nurse Practice Act of the state in which the practice takes place. Option D, American Nurses Association, ANA, professional standards. The correct answer is option C, the Nurse Practice Act of the state in which the practice takes place. 3.